Hello, everyone, and welcome to this session at the ICUDDR virtual conference. This panel session is going to be on sustaining addiction science education during COVID-19. My name is Olivia, and I'm going to be the moderator for the session. And we're really glad that you could join us. And of course, we're excited to have all of these incredible presenters here today. And if you have any questions, please feel free to put it in the Q&A, and we'll get to it at the end of the session. So I'm going to just launch right in, introduce the speakers, and we can get started. So our first speaker today is Cary Hopkins Eyles, and I'm sure that you're already very familiar with her, and she is the Deputy Director for ICUDDR. And also joining her will be Susana Henriques, who's Assistant Professor at the Portuguese Open University. Following that, we will have Yatan Singh Balhara, who is a Professor of Psychiatry at All India Institute of Medical Sciences in New Delhi, India. And then we have two speakers joining us from the Vietnam ITTC, Giang, who is a lecturer, principal investigator at Hanoi Medical University, and V, who is a coordinator at the HIV Addiction Technology Transfer Center at the University of Medicine and Pharmacy at Ho Chi Minh City. So I will hand over now to Cary to start the presentations. Thank you so much.
Thank you, Olivia, and greetings of the day to all. Just to take 1 second and say that Olivia Woodrow has been an amazing support in all of the promotion for the event and getting you all the information that you need. So we're really grateful to have her on our team. So thank you. All right, so we are going to be talking today about adapting, of course, to virtual realities. And I will ask, let's move on to the next slide, please. We are talking about online education and professional training, and I'm so grateful to be able to present and to represent Susana Henriques, who is my partner in all of this. And I've learned so much from her about online pedagogy, and I'm just really grateful for her help. And she'll be here to answer any questions you might have that I am not able to answer for you. Next slide, please. So next, please. So as you all know, obviously, we've all been living through this pandemic, and COVID-19 created a worldwide crisis. And of course, most importantly, public health was affected, but it rapidly extended to different parts of life. And so we're going to talk today about how the pandemic has affected us in terms of health education, health literacy, and all these other terms that I got to learn in the last year and a half or so. Next slide, please. So the World Health Organization defines health education as opportunities for learning involving some form of communication, information, motivation, skills, and confidence necessary to improve health. So it's not something that we maybe think about on a normal basis, but it's so important. And it's obviously heavily related to our personal lives, but also to this field of addiction in terms of a public health perspective. Next slide, please. And so there are a host of elements that are needed and have to be incorporated for better health. And World Health Organization talks about cognitive and social skills and the person's ability to access, understand, and use information in order to promote and maintain good health. And so what I think is so interesting about this is that it's not just about, knowing something, right? It's bigger than that. We have to be able to access the information, understand it, and use it for our own health. So sometimes we know something, but we either don't have the resources or we don't have the support or whatever it may be to actually implement it. And so this is a really interesting graphic, the health literacy umbrella. And it talks about, if you think about these health problems and risks as the rain. I'm here in Tampa, Florida, and we're the lightning capital of the world. We have lots of storms. One came through this morning. So if you think of that weather that's coming down on you, do you have resilient and protective factors? And so some of those can be, is the language clear? It's like if we Google something, some symptom we have, and something scary comes up and we don't really understand what we're seeing. So are we able to access plain language about health education? Do we have the technology we might need? We just had this amazing keynote and there were a lot of great ideas, but do you have the technology for it? Do you have the support? Are you able to navigate through whatever it is that you find out that can help you to promote and maintain good health? Next slide, please. And so this relates to digital literacy. And this is having the skills that you need to live and to learn and to work in a society where communication and access to information is increasingly through digital technology, like internet platforms, social media, mobile devices. And, working in this field, and especially working for ICUDDR and seeing technologically, there's resource constraints that make a big difference. We have assumptions if we're in an area where we can always get on the internet, we always have, the up-to-date phone. But then there's more than that. It's being able to understand and use the technology. It's the ability to, it can be even things like grammar, composition. Are you able to type? Are you able to produce text or images and different things using technology? So there's a lot to digital literacy. And this is something that I just learned throughout this past period of time because of the pandemic. And that may be the same for some of you. Next slide, please. And so why is that important? It relates to digital health. There's this convergence of digital technologies with healthcare, living in society where we want to enhance the efficacy of healthcare delivery, and we need more personalized and precise abilities. So we use these terms like telehealth, telemedicine. Are people able to get their addiction groups and their counseling online if they can't come in, for example? And so digital health provides opportunities to accelerate our progress in attaining health and well-being related to the Sustainable Development Goal with the UNODC and the World Health Organization. Next. So World Health distinguishes between e-health, which is a broader definition, and m-health, which is more mobile digital technologies like your cell phones and tablets that can support healthcare practices. E-health, some of you are using electronic health records, patient administrative systems. I personally have seen my doctor on a screen more than I've seen them in person in the last year and a half. And so that's what a lot of this is referring to. All right, next. Now we're going to move into the concept of a virtual community. And so through this work, what Susana and I did is we combined research, education, and practice, next, in a virtual community. So we took, what a virtual community is a social network of individuals who connect through specific social media, potentially crossing geographical and political boundaries to pursue mutual interests or goals. And so there's three pieces to this. The domain. Domain is that membership implies commitment and shared competence that distinguishes members from one another. Community is that members engage in joint activities and discussion and help each other out and share information. So rather than a competitive model, you may say, oh, that's something that we've successfully done in our area. Let me share that with you. Let me tell you how we've done it. And then in practice, members develop a shared repertoire of resources such as experiences, stories, tools, and ways of addressing problems. Next. And so we have research, our knowledge building, we have education and collective learning, and practice to share whatever things people have come up with, as I mentioned previously. All right, next. So what is this all about? We want to share the fact that with ICUDDR and Susana and myself, we created a problem-solving group to combine these research, education, and practice. Next. And so our problem-solving group was a virtual community of practice that we formed we had 6 sessions between September and December of 2020, right in the heart of the pandemic. And we had 22 individuals who signed up and were involved, and Susana and I were the 2 facilitators. Next. So here's the heart of what we did. We had these problem-solving groups. 2 of them were about implementation, evaluation of experiences. 4 of them had these very specific topics. We had engaging students online. This was our first one, and you can imagine people were very interested in, well, now I'm having to emergently switch to online. What do I do? And so we did a word cloud, you can see it here in the image, about how to engage students online. We discussed different strategies. Susana showed us some great tools. We talked about quizzes and questions and how to be accessible and how to challenge our students and get them involved. We had a second session on diversity and motivating students online. So you may have a brand new student, you may have someone who's coming back to school, you're going to have people from around the world. And so we talked about the best predictors of motivation being, was it perceived relevance, which we know is an adult learning principle with andragogy. We talked about the quality of instruction and learning, the fact that people were, their motivation was affected by technological competency, how much they felt they were technologically competent, and their motivation to begin. And then we talked in our third session about the professor as a leader. And so the focus on the dynamic that exists between digital technologies and leaders, and making sure that the educators took that role of leader. And finally, we talked about digital tools for pedagogical strategies. And so hopefully some of you have been in some of our sessions where there's been some great sharing of things that you can use. We did an evaluation and asked for feedback on this problem-solving group, and we got some really interesting feedback, so I just want to share a little bit with you. One shared, the course helped me to have new knowledge and implement practical strategies to eliminate barriers in virtual teaching. The suggestions of facilitators and the participants were valuable and easy to put into practice. For example, how to engage students or clients in virtual learning, punctuality, teaching strategies, and challenges facing teachers teaching online. And so I thought that was a great example of how the community worked together and the benefits there. All right, next. And so to wrap up, we have so many wonderful speakers on our panel here, and I want to make sure everyone has time. Next, we saw a lot of value here in terms of how you can use this for professional training. And next, we also talked about work-based or work-related learning. And so this is training, the idea that it involves large amounts of training occurring in real workplace guided by theory-based learning. And so it's enhanced by the mediation of technologies and has these advantages. So trainees don't have to travel or spend a lot of time in the classroom. Employers don't have to have their staff leave. They can do training on site. And then the intervention context and the target subjects, as skills are developed, they're transferred to the context of work and intervention. Next. So Susana and I are really grateful for your time, and we're grateful for this experience we had with the problem-solving group. And we hope that at the end of the session, when the time is available, that you will let us know any questions you might have about this model. And it's my pleasure next to hand over the stage to Yatan to continue the topic. Thank you.
Thank you, Cary. Yeah. So, greetings from India. I am Yatan. I'm a psychiatrist. I practice in India. I'm a faculty at a medical university here in Delhi. I must begin by thanking the organizing committee for this opportunity to share our work. As Cary mentioned, that the last year and a half, it has changed the way we, approach our lives, both personally as well as professionally. And whenever there are challenges, we do try to find out solutions. And when we were faced with this challenge imposed by the pandemic in this part of the world, the Southeast Asia region, we tried to respond. We executed a few projects in the region with the support of World Health Organization Regional Office. So I'll be sharing some of that work in this presentation. The next slide, please. So I'll be speaking for around 10 to 12 minutes. I hope I'll be able to finish within that time. And if there are any questions or any queries, I'll be pleased to take them at the end of this session in the Q&A session. So I'll first begin with what was the need. Cary has highlighted it beautifully that the situation changed the way we delivered the services. The situation also changed the way we delivered the trainings as well. So I'll just highlight a few salient points from this part of the world that made it important for us to kind of step in and intervene. And then I'll move on to the second half of my presentation, which will be primarily about 4 projects that we executed and that we are carrying on even now with, just to give you a glimpse of what we did in the last year and a half. Next slide, please. So the need, this is important. This is, I have mentioned earlier as well that it's very obvious the situation we have been facing. And it has been well documented as well that these are tough times, especially for people who are into this sector of addictive disorders and who are providing services in this sector. But the challenge has primarily focused on one part of this situation. Next slide, please. And that one part is that people have acknowledged it widely, that the pandemic has impacted the service delivery significantly. And by that, what I mean is that people have documented that due to the pandemic, the services for addictive disorders and including SUDs, it has been impacted adversely, probably across all the countries, irrespective of the resources that these countries have had. And the second and another very important observation that has come up is that the situation has in many ways been quite conducive to an increase in use of psychoactive substances. People presumed probably in the beginning of the pandemic that since the systems have stopped functioning, it would impact the delivery of the substances as well. But the evidence doesn't support that. Next slide, please. In fact, there are lots of publications that have focused and they have highlighted that because of the COVID-19 pandemic, the treatment services as well as the prevention services for SUDs, it has taken a hit. The services have been difficult for the patients to approach. The resources have been diverted to COVID care, both in terms of the treatment facilities as well as the healthcare workers who are engaged in this service delivery. So that part has been quite well documented. But what has not been documented equally well is the impact the pandemic has had on the training opportunities. And that is important. I'll come to that in a bit. But before that, I'd like to present another fact that supports the second point that I made in the previous slide. Next slide, please. So contrary to what many believed that the pandemic would probably mean the access to drugs will also go down, that actually did not happen. In fact, this is a snapshot from the recent World Drug Report published by UNODC a month back. And they have very clearly documented that despite of the pandemic, despite of the challenges being posed due to the lockdowns and lesser people being out there on the streets, drugs found their way to the end users. And what that means is that coupled with the stress of the pandemic, people were losing jobs. It was difficult times for many of us. So it created that situation where people expected that the use of psychoactive substance is probably going to increase in this year, and this effect might persist for next couple of years. Next slide, please. So this part was very well documented, and it has been covered very well, both in print media as well as in academic literature. But what has not been highlighted equally well is this fact that this pandemic also meant that there was disruption of teaching and training opportunities. As I mentioned earlier, the healthcare workers, they were being shifted on to COVID care. That also meant that the teachers in academic institutions who happen to be the clinical faculty as well, they were now catering to the patients with COVID. The on-campus classes and other activities were shut down. So that also meant that it was not business as usual for the students as well. And in addition to that, whatever other training opportunities existed in this part of the world, which were through in-person trainings and small workshops, a week or a 2-week-long workshop, they also ceased to exist. Next slide, please. Now, when we think of the big academic institutions, the universities, they probably are more resourceful, and that reflected that they quickly shifted onto the online mode. I do believe that the online mode has its own limitations, but given the situation, that was probably the best way forward. And the institutions and universities, they made use of the digital platforms and they quickly moved on to the online classes. But there was no substitute for these in-person trainings and workshops for people who are not enrolled in these academic courses in universities, especially in Southeast Asian countries. And there are a few reasons that I want to highlight this. Next slide, please. Now, in Southeast Asia, there's a very limited workforce that works in the area of addiction. Very few countries in this region have specialized courses. When it comes to the medical doctors, yes, they are being trained in providing addiction services to some extent. But when it comes to counselors, clinical psychologists, nurses, there are very few centers across the region that provide this specialized training. So what it means is that whosoever wants to work as an addiction professional relies only on these in-person short-term trainings and workshops. And since there was no substitute to that, because that's not a very well-organized sector in Southeast Asia, so these training opportunities were almost non-existent. Next slide, please. So this kind of sums up that why we did what we did. There was disruption of clinical services. There was a likely increase in demand for services because of increase in substance use. And there were limited opportunities for training for professionals who were working in the area of addictive disorders. So this kind of made that ground, which made us think and venture into this direction. And then we thought that we need to intervene and we need to roll out certain programs that might be of use to the professionals in the region. Next slide, please. So, next slide, please. So basically what we did, we collaborated with the regional office of World Health Organization for Southeast Asia. We already had a telemedicine facility at our institute. We call it NDDTC AIIMS. And we have been running these online courses earlier as well. But these were primarily catering to Indian stakeholders, and it was restricted to only India. But then we decided that we need to expand it. And I'll be talking about 4 such initiatives that we rolled out over the course of last year and a half. Next slide, please. So the first one was primarily guided by this fact that due to this abrupt lockdown in many countries in the region, what happened was the supply to alcohol, it was just shut down abruptly. And what it meant was many people experienced unplanned alcohol withdrawals, and many of them experienced complicated withdrawals. So there was an increase in patients who required these services. Next slide, please. So in order to ensure that people who are offering care to these patients, they know the right way how to manage these patients, we developed this online platform called ALCOHOL. It's an acronym for Alcohol Use Disorders Online Learning Resources. Next slide, please. So basically what we created was that people who are working with patients with addictive disorders, the addiction professionals, we created online modules for them, separate modules for medical doctors, clinical psychologists, nurses, and other healthcare workers, so that they can get this training online at the convenience, at their own convenient time and place, so that they have the basics clear that how they can offer help to the patients who are coming to these health facilities seeking treatment for alcohol use disorders. Next slide, please. The second initiative that kind of stemmed out of this first one was that this initial alcohol platform was primarily meant for healthcare professionals who are already working in the field of addiction. So these are primarily addiction professionals, but then we realized that since there are very few, proportionately very few addiction professionals in Southeast Asia, we need to develop something for general healthcare providers as well. And that's where this second platform was developed. We are still in the process of developing it, but some of the sections are already there. It's called Master. It's again with the support of WHO Regional Office for Southeast Asia. Next slide, please. So here what we are offering is we are trying to offer simple modules on different mental health disorders and addictive disorders. This is just a few snapshots that I have on alcohol use disorders. Next slide, please. So there is a section on learning disorders. Then we have a section on the common terms that people use when it comes to alcohol use disorders. Next slide, please. Then there is a section on the epidemiology and burden. Next slide, please. We have a section on how to assess these patients, the clinical history, taking clinical examination, the lab investigations that you need to know about. Next slide, please. And we also talk about other substance use disorders as well. So these are again freely available, free to access online modules that exist, which can be accessed by anyone. Although primarily we have developed with the Southeast Asian countries in our mind, but these are available online and these can be accessed by anybody. Next one, please. The third initiative that we took was not for substance use disorders, but it was for behavioral addictions. Another common issue that came up, another public health concern, children and adolescents and even adults, they increased their screen time during the lockdown. Next slide, please. And there were many reasons for that. There was an increase in viewing of OTT platforms. There was an increase in gaming behavior, like this particular study where we documented that almost 50% of students, they reported an increase in their gaming behavior during the lockdown. So what it meant was we needed to develop something for these conditions as well. Next slide, please. So we run this online resource hub, again with support of WHO. It's called Behavior, which is again an acronym for Behavioral Addictions Resource Hub. Next slide, please. So we developed this e-health intervention for gaming disorder. This again is targeted at students. This is an online intervention which they can take at their own convenience, and they can learn how they can help themselves to screen themselves for gaming disorder, and even self-help tools that exist that can be utilized for their own care. Next slide, please. The fourth one, this probably I find it most interesting because, see, during the pandemic, we have been talking about how healthcare workers, they need to take care of people who are suffering around them. But we also need to acknowledge that even the healthcare providers were suffering a lot. They were overstretched, they were overburdened, and we developed this platform to help the healthcare providers to take care of their own mental health and well-being. Next slide, please. So this platform offers different sections where one can access it and kind of find out the self-help tool to take care of their own mental well-being for the healthcare providers. Next slide, please. So there are different sections. We talk about what you can do before you reach your clinical, the place where you work, during your clinical care delivery. What is it that you can do to take care of your own mental well-being? And once you are off duty, what is it that can help you to kind of handle the stress better? Next slide, please. There are different sections. I won't go into the details. For example, there is this section where you can use the simple screening tool to assess your own mental well-being. And then there are solutions that are offered there, which you can utilize and take help from. Next slide, please. So just to summarize, we kind of tried to leverage on digital health. We targeted alcohol use disorders, drug use disorders, and behavioral addictions. Our focus has been Southeast Asian countries, but these resources are available in English and probably can be accessed globally from any part of the world. Next slide, please. So just to conclude, we have the data in terms of how many people have accessed it from which part of the world. Next slide, please. But now we are planning to kind of assess it more systematically. For example, we are running this randomized control trial now to assess the effectiveness of one of these interventions. Next slide, please. So just to summarize, COVID-19 impacted many facets related to addiction, and the training opportunities was one of them, not being highlighted as equally as other parts. But there is a lot that we have learned in the last year and a half, and we do believe that going ahead, digital health can be a very important tool in strengthening the capacity in the region. So next slide, please. So once again, I thank you all for your time and attention. If there are any questions, I'll be pleased to take them at the end of the next session. So I now invite the team from Vietnam to share their work. Thank you.
Thank you, Yatan. Can you see my slide? Okay. Thank you very much, the organizer and ICUDDR, for having us on this wonderful panel. My colleague and I, Ms. Buttervi, and I are very pleased to join this session. And in this our presentation, we will tell you how we sustain the addiction education in Vietnam during the COVID-19 epidemic in the country. I am from Hà Nội Medical University, and Ms. Vu V is from University of Medicine and Pharmacy in Ho Chi Minh City. And we have a few co-authors that we also want to acknowledge in our presentation. Our presentation will cover several topics. One is that I will give a brief overview of the epidemic in Vietnam as a context. And then we'll talk about Vietnam ITTC and how we have responded given in the situation. We'll then talk about some of the key results and finally conclude with the lesson learned. So with regard to the COVID epidemic in Vietnam, as in other countries, we first experienced the cases in early 2020, but for a while we didn't have any huge spike as in many parts of the world. Not until recently, but currently we are in the worst period of the epidemic in our country. And so far, we compared to other countries in the world, our number of cases and number of deaths are still relatively small. But currently, we are in the worst phase of the epidemic, as I mentioned before. And in this figure, we could see that in the we have experienced 4 waves, and currently we are in the 4th wave of the epidemic. And the number of cases have jumped to more than 50,000 with more than that have been detected in Vietnam. And this is such a really a big jump as compared to the 3 previous waves that only recorded less than 1,000 cases in the previous waves, in each of the previous waves. So what I give you a little bit of the context how our government has responded to in order to control the epidemic. And up to the July 7th, all patients, regardless of the severity, have been treated and admitted to the hospitals, and their residence neighborhood have been blocked totally for at least 14 days. So this is very different from many other countries. We admit our patients very early, as soon as they are diagnosed and detected, and regardless of severity. And those in the close contact with the index cases have to be quarantined in the special facilities with very strict supervision. And those who in close contact with the close contacts, they would be quarantined at home, also under very strict supervision. And in the first wave that we are currently experiencing, although there's some recent adjustment due to the high number of COVID cases, but still the supervision and strict in the requirement of the government for strict supervision is still in place. And this is very important for our patients because many of them may be quarantined in the special facilities without any access to medication or any treatment services. Or if they are quarantined at home, then they would not be able to travel to clinics in order to receive medication and so on. And similarly, many of the neighborhoods where the clinics are located are also blocked. So in that case, our patient would not have access to the medication or the staff as well. And that's why we have a lot of the training needs that have emerged in the past year or so, and especially in this current wave of the epidemic. We need have the need to develop and train our healthcare workers on guidelines to provide care for patients who are in quarantine. We have a need for innovative intervention with support from the mHealth and other information technology. We also need to train our staff on the practices in order to safeguard make sure that the healthcare workers and the patient in the treatment facility to be safe and not to be free from the epidemic as much as possible. So let me move to introduce our Vietnam ITTC, which is the host of the ITTC is the Hanoi Medical University, where I am a faculty member. But we also have 2 other institutions, one in the south, in Ho Chi Minh City, and the other one in the north, which is the University of Labor and Social Affairs. And these are the 3 objectives of our ITTC. We focus on developing the workforce. We focus on building the models for integrated services. And we also support the development of policy and guidelines of our government. We have a long history of development. We started first with the V-ITTC, which is in brief for Vietnam HIV Addiction Technology Transfer Center, and started in 2011 with support from PEPFAR and SAMHSA. And at that time, we focused a lot on HIV. But since 2020, we have been now supported by INL by the Colombo Plan, and our focus has broadened to addiction medicine and also to develop the professionalization of SUD treatment in Vietnam. As I mentioned of our history, what I want to emphasize that we had a lot of achievements in the past decade in terms of developing the workforce, developing the faculty members, and also developing the some small scale models for integrated treatment, as well as to support our government policy. So building on this foundation, building on these achievements in the past decade, we are now moving into the pivot of how we could address the COVID epidemic in the country. So as you could see that before the COVID epidemic, we organized a lot of training, face-to-face training, and all of the photos that you show here are the face-to-face, where we have a large number of participants that met in training venues, and we organize a lot of activities with our students. But then when we in 2000, it's the first few waves of the epidemic, when this number was still small, we were able to organize the training events with the smaller number of people. We started to use some of the technology to organize the training, but we still were able to organize the face-to-face events, and we exercise a lot of caution during those events, as shown in the photo here, with the participant wearing masks in the practice session or in the meeting room. But after May 2021, when we started to experience the worst wave of the epidemic, all of the activities have moved online. And here you could see that we organized the online session training, we organized the patient practice, and then we video and then you post that on YouTube for our trainees to study in advance. And then in July 2021, we organized some event that attract a lot of the attention of the healthcare providers. And Ms. V will continue to present this part. Ms. V.
Thank you, Dr. Giang. As Dr. Giang mentioned, that we start of the distance learning model in Vietnam since 2017. However, at this time, we focus, I think that 90% of the work more focused on inpatient. And when the COVID hit to Vietnam, we use this experience to treat on the online platform. We from and like Dr. Giang mentioned, this way in the fourth wave of Vietnam is very serious situation in Vietnam. On the training and technical assistance, we turn to online activity. Next slide, please. And as you can see in the slide, in 2020, we more focused on some training. As you can see in the blue, and we had some training on counseling, diagnosis, on treatment and prevention for hepatitis C and hepatitis C. We had some session on COVID, but not much. And we have some session on methadone and for RV clinics. However, since May to July, we still have some session on methadone and more session on COVID. And if you can see, just 3 months, but we provide more training like 18 training for over 1,400 participants. And we have more sessions on COVID and ATSU among men have sex with men and transgender women. And we also invite some international experts to share about managed methadone program during the COVID COVID context. Next slide, please. How we can disseminate our work? We develop the online libraries. For example, like website, we have a Facebook, and we create the YouTube channel and we record the online training and we post in our YouTube. Not only one session. We not post in our YouTube case conference because the private observation that we not allowed to post it. All the another training we post in our YouTube and website, and all the participants easy to access our training material. Next slide, please. And here is some our experience, how we connect our audience. Like in the Cary presentation, she shared some experience, and we connect with our participants via Facebook, via YouTube, via MailChimp, via email, and we have a website, and we allow different way to allow the participants to attend our training. And for the last two sessions, we also do our live stream in the Facebook, and we can connect more participants via live stream, because especially our patient, if some information for our patient or community-based member, they prefer to accept on the Facebook rather than like very informal on a Zoom section. Next slide, please. I think that now Dr. Giang, we summarize by what we learned from our lesson learned.
Thank you, V. Let me finish this one. Okay, so as you could see that we have described this COVID situation in Vietnam and how we have tried to respond in order to sustain the addiction education, and also add on more topics that are relevant for our healthcare providers. The lesson learned, we should see that the online training, the technology-based training really could accommodate more participants, especially those who are in difficult settings, as I mentioned before, that have been created by the epidemic and by our government policy, and also with much lower cost. We also were able to address the needs that have emerged during the epidemic, and this is also an opportunity for us to develop the continuing medication education program in addiction and in substance use disorders that have been very much needed in the country. And also this is an opportunity for us to connect with the international experts who have experience in addressing the epidemic in other countries. And from today's session, I would definitely connect with our colleagues in other parts of the world, India, in the US, and other countries, in order to share and learn the lesson from them. What needs to be improved? I think of course, the infrastructure and the experience to organize the online education, and especially how to create the experiential and the practical activities for our participants. We also need to develop more technology innovative strategy in order to deliver mHealth intervention for our patient, and also to use that and train our providers to deliver those innovative strategy. Thank you very much for your attention, and please follow us on our YouTube, our Facebook, and our website. I look very much forward to the discussion that follow this presentation. Thank you.
Thank you so much. And thank you to all of the speakers who've presented in this session. We really appreciate your time to join us today and your insights that you shared. To the attendees who are watching, if you have any questions, please put them in the Q&A box, and we now have a short period of time to answer them. Please send us a message if you have anything. We have one already that's come through. This is to Cary. Are you planning a problem-solving groups in the near future?
Yes, we will definitely. We don't have one scheduled yet, but we will absolutely have them again. That's something that we found really valuable. Problem-solving groups, and also some of them we call learning collaboratives on other topics that we've worked on. So yes, we will definitely. And if you're interested in general or in a particular topic, please let us know, because we'll be coming up with what we're going to do in the fall.
Great, thank you.
Yeah.
Some other questions just in general. I think based off the recent presentation from the Vietnam ITTC, you obviously highlighted the opportunities that came from the challenges that the pandemic presented. And I'm curious to know whether you had any of the things that you implemented. I think this is just a general question, as part of your online education that you think will continue, post-pandemic. Or you would like to develop further?
Yes, thank you very much for your question. Yes, we definitely want to expand our online education further, and as well as the technical assistance. And I don't know when we would experience the post-epidemic period. But as you know, we are a vast country with many of the remote and rural communities where our providers, I think that they would benefit a lot from this kind of online training and online technical assistance, as well as the innovative strategy to deliver the mHealth intervention. So I think that the epidemic actually pushed us to move faster in the direction that we have been planning. But I think that this is definitely the direction that we want to move in the future.
Great, thank you. Yeah,
and I was just going to say, I think like the Dr. Giang is right on, and Susana and I have talked about this too, that's exactly what I think has happened around the world, is things that were probably going to happen eventually were greatly accelerated in terms of online learning, in terms of the different technologies, telemedicine, so many different things. And for me, I think, a lot of what we do for ICUDDR is, online because of the international component, but our conferences are usually in person. And while that will not, we will go back to that because it's so important, there is what they call a hybrid model that I've been learning more about, where, you can have your session in person, but you can also, have part of it streamed, right? Or have the whole thing streamed. You can still have questions come in from online. You can, there's a lot of different ways that you can take the online learning component and make it part of what you're doing without losing that in-person, the strengths of the in-person as well.
Yeah, that makes sense. Did anybody else want to comment? Susana, did you have anything you wanted to add?
I was just thinking that something that I read of a Portuguese author, and he said that this pandemic was like an opening gate, and our job is not to allow that gate closes again. So somehow create a strategy to maintain this gate open, and mainly in education, allow this development and this innovation flow to continue and to improve our job and our mission too.
Yeah, I like that analogy. That's great. Thank you. I think we just have time for maybe one more question. Thank you, Bill, for your question. What technology would help you with your online training? What do you utilize? That's a great question. Thank you. Just to anyone who would like to go.
I don't know if this is exactly Bill's question, but I think the challenge technologically that I see is just that internet is not great in so many parts of the world. And so I am familiar with some technologies where you can actually, I'm completely not an expert, but where apparently you can somehow boost the internet in different areas. And it's like something you can buy and basically give to people, because I mean, we can't pay for, internet around the world, but there may be technologies we can do to improve that. So I'm not sure that's the question, but it's the first thing that comes to mind for me, that, so many of our students who are really, they really want to be in these sessions. I think I'm thinking of a lot of colleagues from Nigeria who are so passionate and would like to be more involved, and then they get on and they really can't fully be engaged because their internet is cutting out so much.
And I also may add that it takes some adjustment for both participants and trainers to move from face-to-face offline to a online kind of session. So, for example, how to give clear instruction to the participants so that they can use the technology properly, and there's no interruption and all of that, and also for the trainer on the way how you deliver the online lecture is maybe quite different from the way you deliver the face-to-face lecture, right? I mean, you had to pay a lot of attention to your face in the first place, and then in the face-to-face training, you pay attention a lot to the reaction from the participants, but it's not, sometimes it's difficult in the online situation. And as I mentioned earlier, how to teach the practical session is always challenging.
May I just?
Yeah.
We just heard the keynote speaker, Leonel Morgado, before saying that technology or immersive environments are very important, but are not the only thing that is important. So I may have the most advanced technology and a good connection, but as a teacher, as an educator, I must know what I want to do with that. And there is no the best technology. There are good professors, there are good strategies, there are learning goals, there are skills and competences to develop, and it is to respond to all that I'm going to choose the technology. If I want to explain a concept, or if I want to actually give a lecture because the theme is so important, maybe the Zoom is the best technology for me and to achieve that goal. But if I want to have some collaborative or some skills development more demanding, maybe I need one of that immersive environments to help me to achieve that goal, that learning goal. So the technology is not the most important. It is very important. And it was something that this pandemic showed us if we had some doubts. But it is not the only thing. It's not the main aspect in the learning environment and in the learning process, in the teaching learning process.
Absolutely. I would love to continue this discussion, but I'm afraid we're out of time, sadly. But I just want to say thank you so much to all of our speakers who joined us today, and to all of the attendees who've been watching and sending messages and questions. And I hope that you enjoy the rest of the sessions that will be happening today. And, just in case you missed anything, there'll be recordings available after the conference. And I'm just going to give a shout out to the social media, because obviously I've been involved in that. But if you want to come and contact us on Twitter or Facebook, please do. We'll be there. So thank you so much. Wishing you all a lovely rest of your day. And we'll see you soon.
Thank you.
Thank you.
Thank you all.